At this ASH 2021, I think it's probably fair to say that for the myeloma component of the meeting, one of the big studies that's being discussed is the iStopMM that is from Reykjavik in Iceland. I'm a co-investigator on this study together with Dr. Sigurður Kristinsson, who is the lead principal investigator. We have worked on this for many years, and he has done a fantastic job setting up the team, enrolling all the study subjects in Iceland. When we designed the study, we reached out to all Icelanders that were 40 years or older. And within a very short period of time, 75,000 individuals agreed to participate in this study, which is unbelievable. 75,000 about individuals were thereafter screened to see if there was evidence of myeloma precursor disease in their blood. At this meeting, we hear the first results from this huge effort that is going to go on for many years. Some of the high points that we hear at this meeting is on the rate of detection of monoclonal gammopathy. That is in line with prior studies. We also hear about the rate of smoldering myeloma that has never been done in any population before. That's about 0.5% in this population. There is also information communicated at this meeting, for example, on the rate of contracting the COVID virus among people with monoclonal gammopathy versus people who do not have monoclonal gammopathy. And I think very important information from the presentation is that there is not an increased risk of COVID. And in that same presentation, among patients who do contract COVID at the same rate as the general population, there is no evidence that the prognosis is different in a person who has a monoclonal gammopathy and contracts COVID. So I think this really puts new light on the question on plasma cell disorders as risk factors for contraction of virus and prognosis of virus. Probably when myeloma has taken off, there are more things that have happened in the body. And also, of course, the treatment for myeloma, transplant and other chemotherapy drugs probably contribute to weaken the immune system. And that's probably why myeloma patients have a different outcome when contracting virus compared to what this monoclonal gammopathy study shows. There will be many more studies, and there are additional studies also presented from the Icelandic study. There will be, in coming meetings, focus on the emotional burden of being diagnosed with a monoclonal gammopathy. And of course, the primary results, which is to really see the impact of screening in a population, that's going to be very important. That is the primary endpoint when we designed the study. So screening 75,000 people, they were randomized into 3 arms. Arm 1 has the information kept in the study, and the individuals had consented to not be informed about the diagnosis, whether they had MGUS or not. Arm 2, they are informed and they are being followed the standard way. Arm 3, they are informed and they are followed in more detail with additional tests. So this will allow a very solid and strong statistical approach to answer the question whether screening has impact on prognosis and complications of myeloma. Because you can compare the first arm where you do know who had MGUS, although that was not clinically declared and it was not managed. So this is a complicated study, and it probably could not be done in every part of the world. For sure not in the United States would you be able to screen individuals and have that as part of the study without confirming that to the patient. But that's how the Ethics Review Board approved this study. So it's going to be a very important study. My prediction is probably it's going to show that screening is the way to go, and we will identify individuals. I think that will be important, but I think another question now comes up on the table. If you identify the monoclonal proteins, only a small proportion of patients will actually progress. So how is that going to be managed? And we are opening a study in Miami called the Transform study. that's going to open in the first quarter of 2022, where we will screen 1,000 people with evidence of monoclonal gammopathy or smoldering myeloma to study the genomics of the disease. And there will be discussion on this very topic at the educational session on what's new in plasma cell disorders at ASH on Monday.